Celebrate the vital role of nurses in healthcare this week for National Nurses Week in America.
Joining us now for more in this sponsored interview are Sue Roble, the president of the Utah-Idaho region for Intermountain Health, and Amy Christensen, the chief nursing officer for the Utah-Idaho region of Intermountain Health. Welcome to the both of you.
Thank you.
Thank you.
Thank you for inviting us.
Well, yeah, this is a privilege.
Here, Nurses Week. Let's start with you, Sue. Will you tell us about the significance and what it means this week?
Well, this is a time for us to really thank and celebrate and share gratitude with our nurses. We really focus on that all the time because there are so many amazing stories to tell about them that they do for patients above and beyond caring for them, which is so special and an honor and privilege. And it's our time just to spend to, intentionally give them a lot more love and food and share these great stories. And Amy, there's things planned. Maybe you want to specifically mention some of those items?
Each of our facilities really plan their own celebration because it's about the team, and that's where they connect the most. So each hospital or clinic will put together a plan. They have activities all week. We really want to highlight the work of the nurses and really celebrate the things that they're doing.
Amy, Intermountain Health employs right now 18,000 nurses in hospitals and clinics and home health and telehealth and other healthcare settings. And so they work in a variety of different locations and even schedules. And so important the work they do in each one of those roles. We're always needing more nurses.
We are. So I would say, please, just Happy Nurses Day to any of the nurses that are out there, even if you're retired. The great work that you've done is so important. And I would just say right now we've got patients that are more highly acute than they've ever been in our hospitals. And we're also moving upstream. So we have a lot of nurses in primary care and doing care coordination and the work that keeping people well, right? As we move to proactive care and value-based care, we really want to focus on people controlling disease, helping them be well so they can do what they do best in their families and communities.
And with the aging population, you say that nurses are in demand more than they've ever been. And what kind of person does it take to jump into this field? It's a very special one.
Well, I've been a nurse for 41 years, and I'm so proud of that. And it's about caring for people. You go to work to do the right thing and have the desire to serve in a way you've never been able to serve before.
Sue, why did you decide to become a nurse?
Well, I had the opportunity to take care of an elderly patient in a local community hospital where I grew up and sat with her while she passed away and took care of her for many months as a nursing assistant. And that changed my life. And it, told me that this is what I need to do. And she said to me, "You better become a nurse." And so I will never forget her at all because she really set the tone. And what a privilege it was to sit with her and be with her and care for somebody. It's just an honor.
To be with somebody in times of sorrow and that joy, and to really change lives of the families. That bedside manner is everything. Mm-hmm. So there are some new programs coming up to learn about and get involved with. Tell us about those.
Yeah, the first one I would tell you about is our I Aspire program at Intermountain Health. It was a program designed for nurses by nurses, and it really recognizes the clinical excellence that they provide to really keep nurses at the bedside, providing care to patients, as well as their professional growth and development. So it recognizes both pieces. And so we've had a ton of interest. We just launched it this year, and we have over 2,000 nurses that are participating across the enterprise. Just really excited because it's going to get them more involved in not only new evidence and production of new processes and protocols, but also will recognize the work that they've been doing in patient care.
Also tell us about the Nurse Leadership Academy pilot program.
Yeah, so the Nurse Leadership Academy is a new program where we're going to start with new managers, because a lot of times when nurses become leaders, they've just been nurses on the floor that have kind of stepped up to lead, and so they may not get a ton of training. So with this program, what we're going to do is provide some education as well as simulation opportunities for them to really get involved, especially in some of those crucial conversations and crucial moments that you need to have in leadership. So super exciting.
And you said again that each location has their own celebrating, their own
They
themes
do.
throughout the week. What are some that you've had a hand in that we can expect?
Yeah, so our theme is leading with heart, practicing with care. So that's kind of an overarching theme, but everybody has their own interpretation. So they're having luncheons and different, sometimes recognition teas around the work of certifications that nurses get. So there's a lot of different fun celebrations, but many times nurses just like to get together and have lunch or eat, right?
And Sue, if you know a nurse in your life, say thank you to them this week. All the time, but especially this week.
I want to say thank you to all our nurses in the state of Utah and beyond. The impact that our nurses make on people's lives every day is just so significant. So thank you all, and especially our wonderful Intermountain nurses.
To learn more, everybody, about a career and all those opportunities at Intermountain Health, you can go to their website. We'll put a link. It's on your screen, but we'll put a link on our website too, abc4.com/GTU. And our thanks to Intermountain Health for sponsoring this interview. Ladies, thank you both for all you do. For our
Thank you.
Thank you.